For nearly 2 decades, we have been building healthcare system, infrastructure, data platform, and compliance-heavy environments where precision really matters. 340B Pulse is about thoughtful, operator-level conversations, not noise, not headlines, but real execution discussions, how this program actually functions day to day, and more importantly, how leaders navigate the hardest decisions. What happens to 340B saving after they arrive at an organization?
It's Tug River Health Association. We are a very small rural center located in the southern part of West Virginia. We have a total of 6 clinics and a mobile unit that we use whenever we need.
And David, what are your thoughts about AI? Do you think it can help your organization?
And then when they start saying, oh, we want to be able to use your information and use AI to collect it, they're going like, oh my God, my information is going to be everywhere. And like, no, it's not. It's just going to be in-house and through our process.
Welcome to 340B Pulse, a North Arc Health podcast powered by Purologix. I'm Muhammad Atif, your host. I'm CTO and founder at Purologix and North Arc Health. For nearly 2 decades, we have been building healthcare system, infrastructure, data platform, and compliance-heavy environments where precision really matters. Over the time, that work brought us closer to the financial and operational pressures shaping healthcare leadership and 340B today. And that's really why this podcast exists. 340B Pulse is about thoughtful, operator-level conversations, not noise, not headlines, but real execution discussions, how this program actually functions day to day, and more importantly, how leaders navigate the hardest decisions. And today we are talking about something that doesn't get discussed enough. What happens to 340B saving after they arrive at an organization? While 340B is often discussed in terms of compliances, policy, and legal challenges, its real impact depends on leadership decisions made inside the organization. Those decisions are really simple. They are about balancing competing legitimate needs like patient programs, pharmacy operations, staff retention, compliance infrastructure, technology investment, and long-term organization stability. And the truth is, mission impact only happens when those decisions are intentional, defensible, and clearly aligned with the organization's missions. To help us unpack this, we are joined today by David Dunson. David brings decades of experience across community pharmacy, healthcare center leadership, and 340B program management. Throughout his career, he has worked at the intersection of pharmacy operations, organizational leadership, and service to underserved communities. He brings a perspective that goes beyond compliance, focusing on how healthcare organization makes thoughtful decisions about resources, balance competing priorities, and translate 340B savings into meaningful mission impact. David, welcome to 340B Pulse. We are really glad to have you here.
Hello, glad to be with you.
Great. Thank you, David. Before we jump into the details, tell us about your story. How did you get into this space, and what keeps you motivated on a day-to-day basis?
Yeah, I've been on both sides of the rural health centers. I have been on the board, and I was acquired in 23, and I became an employee of Tug River. I was asked to join the board back in 98 and served for 25 years in multiple capacities, about 8 years as president, 8 years as treasurer. And during this time, I really saw the need of the different programs, because when I joined the board, Tug River was in conservatorship by HRSA because of outstanding issues. And I was asked to join by the new administrator to help get this resolved, which over time we did. And so by doing it wisely, financially, and all that, I have seen the growth of Tug River. And then in 23, they approached me about acquiring my pharmacy to serve as the in-house pharmacy. So we could do a lot of different programs that we needed for an in-house pharmacy. And it has been a very good marriage for all of us. And I feel like we have been able to benefit because the 340B program has been able to grow due to this. So you're looking right now about 28 years of dealing with the different rural health centers and 340B issues.
Great, awesome. So you bring up plenty of experience here. So tell us about the organization. Like, what organization do you lead 340B for, and how big is your program?
It's Tug River Health Association. We are a very small rural center located in the southern part of West Virginia. We have a total of 6 clinics and a mobile unit that we use whenever we need. The population in our area is very, very small. McDowell County, which is where most of our centers are, has a total population of 17,000 people. We serve the poorest of the poor in the area. In the state, we're number 55 out of 55 in the poverty level, and we're number 8 in the U.S. according to the 2026 as far as the poorest county in the U.S. So we really have patients that need our help, because without Tug River, a lot of them would not be able to get any health services.
Got it. It seems like you guys are really adding an impact. So let's start with the foundational question. When you hear turning 340B saving into mission impact, what does that actually mean to you as a leader? How would you describe it?
Well, our total mission statement is, just to paraphrase it, is every patient that comes to us will get service, no matter their ability to pay or not to pay. So our main part of the 340B revenue, or not net saving, is to provide patient service to it. And by doing this, we're able to, because we have one of the largest uninsured population in the state. We roughly 15% of our patients are uninsured, and then we have a large group that are underinsured, which has a high deductible premiums on that. So we're able to use a lot of our 340B savings to be able to provide them their coverage through medical, dental, and prescription services, which improves their overall health outcome. And that is one of the main driving forces for our program. We've been, Tug River just celebrated its 50th anniversary as a clinic. And it started off as a single small clinic in the middle of the coal fields of West Virginia to serve coal miners in their issues. And we've grown to take care of the patients in that area, because our patients are some of the unhealthiest and most in need to have services. So without the 340B program, we would not be able to do that.
Got it. Right. And I love your statement when you say the mission is that every patient gets served. So I think that definition matters, because in many organizations, every department defines success differently. Like pharmacy leaders focus on operations, financials focuses on sustainability, clinicians focus on patient care, compliance focus on defensibility, executive focus on the organization's long-term mission. They are all right. Each perspective is valid. So according to you, how do leaders actually create an alignment around a shared understanding of what mission success looks like?
What we all do is we have a 340B committee that we do. We meet every month to discuss the 340B programs between all disciplines of our clinic. And in this, we are looking at our needs. And with these needs, this is both medical, physical structure, patient outreach, community care, and all that. And so we're always looking how we can benefit the community using these programs. And we do have the people pulling. As the pharmacy director, I would love to have most of the 340B net savings come to my program right before more. But we really have, one of our major push that we've had is, in the past, we had the dental program. And for a while, it was dormant. And we started to see the need of the dental program as a major need for the area, because our patients were not able to get dental care. If they were under the state programs, pretty much if you were an adult, the only thing you had was extractions. There was no savings they did nothing to try to save the patient's teeth or whatever. And by this program, we're actually able to help the patient and not, quote, extract everything on that. So when we started looking at how the department started working, we really started focusing on using the 340B as a driving force to get the dental program back up and going. So that was one of the major issues where when we were looking at it was like, how can we all use it to the best? And the management and all the health and that, we decided to really focus a lot of our net saving on that program because it was more needed in our area. So I feel like we work well as leaders through all the departments and everything. And it's focused for patient outcome is our main goal on that.
Got it. And I think you described it very well. So according to you, like what kind of needs typically compete for the same 340B resources in your experience?
Well, it's always, of course, we always know it's keeping the physical structure up because we are an older, most of our clinics are older clinics that have been around for a while. So we're always having to do renovation and the physical plant maintenance on that. Then we also have our new programs that we want to do, which is through community outreach of patient coverage, prescription coverage, and our technology. So when we are looking at this, we have to look at the program and see where the savings can be most beneficial. And as I said, right now the priority is on the dental, but we also look at our physical structure. And a perfect example of this is when Hurricane Helene hit several years ago, we were without power for all of our facilities for a week. So we were looking at providing whole unit generators for the faculties versus starting the dental program. And when we started doing an analysis of it, the generator would be used very sparingly. The dental program would be used every day. So when we looked at the priority, the patient outcome was more important than keeping the physical plant through the generator. So it was a thing of being open versus serving the patients.
Great. Yeah, and I love that the patient care is like definitely prioritized in this case.
Yes, always.
Yeah. So let's talk about the leadership under uncertainty. Like we all know that the reality is that we are all navigating right now. Manufacturer restriction keep changing. Policy is uncertain. Regulatory scrutiny is increasing. No healthcare leader knows exactly what the 340B environment will look like in next maybe 2 or 3 years. Yet you still have to make allocation decision now that will impact your organization for years to come. So how do you allocate resources when the environment itself feels this uncertain?
Yeah, we started doing this when we found out about the Medicare Part D rebate program and all that. We started looking at this last year, and we actually took our budget and we were proactive in this approach. That we knew that was going to affect the net savings for us. So we went in with January 1st that we were going to see a reduction in the 340B revenue because the net saving, because of the Medicare Part D rebate program. And we were going like, it's not what if, but we used the term when something is going to happen. and that's what most people don't look at. If you look at from financial to SWOT, strength, weakness, opportunity, threat, most people always look at their strength and opportunity. They don't look at their weakness and their threats to their program. And we always look at the weakness and their threat to our program, because we know in the 340B program and in the grants from HRSA and all that, we are going to see decreases in these funds at time. So you cannot run like you did 3 years ago when the funding is lower. So what we did was we were going like, when this happened, not what or if it happened, we have to be prepared. So we started making cuts into how we were going to fund different departments in that. And it has been beneficial because what we projected is pretty much what we were seeing from last year to this year. So, and you know, in the future, we do not know. We're all fighting with the 340B program because what's going on up in Washington, D.C., we do not know what's going to happen. They are really looking at ways to decrease the 340B program. Tug River is a perfect poster child of the need for the 340B program, because in the last 5 years, our annual cost of serving a patient has went from $1,100 to $2,000 per patient we see, with the national average only being $1,100. We need the funds from the 340B program to help to be able to sponsor all of our programs that we like to use and do with our patients.
Got it. Totally agreed on that. And I believe, David, all of this require a structure, governance, decision-making processes that are clear and repeatable. So according to you, what should a good decision-making process around 340B look like? And what problem do you see when organizations don't have one?
Yeah, one of the things is a lot of the organizations, I'm just going to use the term, they use the 340B as their cash cow. It is the way they generate net savings for their program, and they think it's going to be that way for a long, long time. And they don't prepare for the future. And because of that, they will go like, oh, this year we had a net savings of XYZ. And then the next year that decreases greatly, and they go like, oh my God, what happened? Because they were not looking at the future. So when the governance and we do this, we have an excellent board that we work with. We go to them and we approach it that this is what we're expecting. This is what we hope happen, but this is what might happen. And we go through all these scenarios. So if the board is not listening to the 340B committee and taking advice, it can have dire consequences on their financial stability. And we need to make sure that all the organizations actually look and see that the 340B might have a major decrease. And if they don't, they're not going to be able to provide the patient services or the outreach programs that they want to do.
Got it. Right. So, David, let's talk about governance and defensibility and what that actually requires. Like when you sit down with a board or regulatory and you explain how you use 340B savings, what evidence do you need to have? What does proof of mission impact look like in your organization?
Yeah, what we do is when we are presenting it to the board and all that, we really show them how we're able to document everything that we're doing with them. They can ask us how many patients are in the 340B program, how many people are their demographics qualify, and we're able to do that. We use our in-house management staff to get all of our data for the board and for the senior management of the organization. And what we would like to do is, with the proof, we're constantly doing internal audits. We're doing mock audits. We are doing notations. And when I say notation on it, we're actually looking in the patient's records to make sure that we have, when we provide or refer them to specialists, that we're getting consult notes back from the specialists so we can actually apply and use them in the 340B program. Because I wish we could use the Genesis ruling across the board, but there is no true definition of a patient, a 340B patients. It's very vague. So when we're doing this, and we make sure that in our documentation, we're applying 100% by the HRSA ruling of the patient definition, by having that they are one of our patients, and or if referred out, we're following through the standard procedure of interdiscipline notation.
Is there a type of mission impact that's hard to document, even though it's a real?
We always, with the in-house management and everything, we're using the documentation. Cheryl Mitchell, who is our special project coordinator, and I pretty much run the 340B program for Tug River. But we're using our compliance officer, we're using our network officer, we're using our information officer, we're using people from all over the thing to make sure that all our documents are 100% up to date at all times. So if we ever have to have a HRSA needs anything, we're ready. So we don't have to go and try to pull it together all, at once, because we believe it's one of these things you have to be prepared at all times. Organizations that are not prepared to provide documentations when requested will struggle, and you don't want to do that. And because the documentation is what saves the organization. Is we don't use the term document. So, and I had an old boss when I worked for a company. I'm not going to put it quite the way he did. He said, to details, you have to be able to pull fly crap out of pepper. So he was always said, you have to pay attention to detail.
Got it. Yeah, so I think you brought out very good point. And from there, we all know the rising cost of compliance. I want to talk about something that doesn't always get captured in mission statements, but it's a huge part of the reality, the cost of managing this program. We all know that the 340B environment has become increasingly complex, like manufacturer restriction, audit requirements, reporting expectations, compliance burden. So my question is that how much of your organization resources go towards simply managing this program effectively versus balancing these operational requirements and all these compliance requirements?
We probably are, because we do everything in-house. Our cost is very low compared to most organizations, because we do everything in-house. We do not. The only thing we outsource is pretty much through the third-party administrator, with our TPAs, that collect our data and all that. But through the management of running the program, we do it in-house. All of us are pretty much salary, so our cost is fixed, and which the organization probably loves, because we do a lot of it off-site when we're home and all. And by doing it in-house, we're able to reach out to each other when we got questions. And it was probably less than 25% of the total net savings is based on the management of the 340B program.
Got it. And David, what are your thoughts about these all compliance requirements? Last year, we saw there was a debate program that was launched as a pilot, and then it went on hold due to the court intervention. So what are your thoughts about all these increasing demands about reporting, transparency?
Yeah, the reporting issue, we were already ahead of the game on this.
Mm-hmm.
We were already doing reportings to all the manufacturers because we did not want to, like I said, we wanted true transparency at all times. So we were already doing the reporting to every manufacturer that was requiring it. So when this became an issue, we didn't have to go out and try to pull everything together.
Mm-hmm.
We were already. The hardest part, though, is now that you have multiple reporting companies,
Yep.
it was trying to get your templates done so that reporting agency A and reporting agency B had different templates that they use. So it was going in and working with the TPAs to get the data, and we could put it in the template where when we reported it, it met all of the requirements that they needed. So it was just a very simple process for us because we had it in place. But a lot of the organizations were not doing the reporting. So when it became time to set this up, they had to go out there and build new templates for it,
Right.
which made it difficult for them.
And for that, are you guys working with any specific TPA, or do you have any software that helps you in these templating and reporting?
What we do is we get the data from the TPA and we import it into our templates.
Right.
And by that, we're able to sort our own. Once again, we are pretty much in-house for just about everything except for our TPAs. And I tell anybody that does not use a TPA, they are making a huge mistake because when we first started the 340B program, we did everything in-house.
Right.
And it is a very time-demanding process. And we started realizing that, and we went and we use TPA for everything now that we can.
Got it. And when you say in-house, are you using any technology as well? Are you just relying on the human talent only?
We use basically different management Excel, Word, all that to create our template. We use mainly human for most of it, but what we do is we're always doing audits through this, and we do random audits every month. We pick a large number of 340B claims to make sure that we're in compliance. And on average, we're greater than 99% compliance for every claim that we submit. So I feel like that's a pretty good ratio.
Great. And David, what are your thoughts about AI? Like, do you think it can help your organization to speed up some of the processes?
Yeah, AI is definitely going to be the future. It is one of the things that I see that's going to take everything we're doing and be able to take I almost say 10 hours of process into 10 seconds of processing time, because it already knows what it's looking for and analyzing. And by using the multiple streams of data, it can look and find and not necessarily correct, but can send the information back to us to be able to correct it. So I really think AI is the future of all healthcare. It's a perfect example at the last 340B conference in San Diego. The keynote speaker showed how AI was mapping the genomes and how all of these different researches are finding this mapping and able to find treatments based on this. And if we can do that on the genome, just imagine what we could do with AI in the data processing area.
Yep.
So I really think AI is going to be the future. Will it be the future before I retire? I don't know. But how fast it's coming along, I would not be surprised.
Got it. And David, but there are like another thought about especially in the healthcare, about the data privacy and all the like security concerns as well. So, what do you think about that? There are people who are very concerned. They don't want to give any healthcare data to these AI models.
It is going to be difficult because a lot of people are very private in their information,
Yeah.
and just I'm going to use a perfect thing. We try to collect the demographics on income, and it's a broad spectrum. They don't want to give that because they don't want people to know. And then when they start saying, "Oh, we want to be able to use your information and use AI to collect it," they're going like, "Oh my God, my information is going to be everywhere." And like, no, it's not. It's just going to be in house and through our process. And they, once you explain it to them, it really, a lot of them don't stress out quite as much, but a lot of them do think that security and that the information is going to be shared too much. So it is just orientation and making them feel safe and comfortable by doing that. And most practices now, when we are going in there, you go in to see the provider, you tell them that it's going to be recorded and we're going to use AI to help in this, where we can document and analyze our meetings, our patient visit and all that. And most of them are feeling comfortable with that.
Got it. Yep. So, David, you were talking about you were at San Diego. So, are you going to 340B collision in summer as well, happening like this
In
month?
DC, and yes, we're going. Our group is going. As of now, it will be our CEO or Chief Financial Officer, Cheryl Mitchum, who is our special project, and myself are going on that. And it's the 340B conference. We took our CEO and our CFO first time to San Diego, and they were shocked at all the information that was going on. They were talking about this. They felt like their head was spinning after every session because they were getting more and more data that they did not realize that with the 340B program that we had to maintain. So it really helped. And the good thing is, though, they allow Cheryl and me to manage the program. And when we need, we go to them. So it's really it's good that they put enough trust between us that they know that we're going to manage the program to the benefit of Tug River.
Awesome. Yeah, that's great to hear. So, David, let's have a quick rapid fire round with you.
Okay.
It will be short question. You can answer yes or no. Let me know when you are ready.
Okay, I'm ready.
All right. So, can compliance itself be considered mission impact?
Yes, the compliance is always, because if you're not compliant, you cannot run the organization.
Can a good allocation decision still look unpopular in the short term?
Yes.
Should long-term sustainability sometimes take priority over immediate patient needs?
Yes, because if you're not able to provide it in the long term, it's sort of like immediate gratification versus long term. It's like buying that brand new sports car when you know you need to pay that credit card. So that's the way it has to look.
Is mission impact sometimes impossible to quantify?
It is, because people do not see how you're able to control the mission statement and mission impact, because it's a lot of it's behind the scene.
Can an organization be mission driven and financially conservative at the same time?
Yes.
Should organization invest in infrastructure before expanding programs?
The expansion of programs is what you want to do, but once again, you have to be stable.
Got it. Very clear. Thank you, David. So, David, we have covered a lot of the ground here. Before we wrap up, I want to ask if you could tell healthcare leaders one thing about mission impact and 340B, one thing that might change how they think about the decision, what would it be?
The main thing is 340B and mission impact is they are definitely go together. You cannot have one without the other. But your mission impact is you cannot. I'm going to use the thing. We are a very, very small center. Okay, we are a very low demographic area. A lot of the 340B programs are in these huge population area, and they are able to generate more net savings for their centers, and they're using it as for building new structures, acquisitions of other practice and all that. And sometimes they might lose the mission impact statement of the 340B because they're seeing it as an opportunity for nothing but growth instead of patient outcome. So if you're looking at the 340B, you really should look that it is for the patient and the sustainability of the practice. And if you're not doing that, you're not doing the 340B program justice.
Totally agree. Thank you for that advice. And David, for anyone listening and want you to connect with you to learn more about you or your work, what is the best way to reach out to you?
You can reach out to me through my email. It's Black Diamond Pharmacy at frontiernet.net. And that's the one at my workplace that I'll use. And I'd always check it and all that. So if anybody ever has any questions or anything, reach out to me and I will try to get back to them and hopefully give them the correct answer that they want.
Thank you. David, this was really insightful, and thank you for joining and sharing your experience with all our listeners. And to everyone listening, thank you for joining us on 340B Pulse. This is the conversation healthcare leaders needs to be having. We shall see you next time.